Thank you for joining me in today's presentation. I'm very excited to share some information on the hyperbaric oxygen therapy, or HBOT. In this presentation, we will discuss hyperbaric oxygen therapy and the science behind the treatment, our specific chamber, the physiological changes that occurs, benefits, indications, and contraindications, as well as frequently asked questions. By the end of this presentation, you should have a good grasp on how the treatment can benefit you and your clients. Let's dive in. Here is a quick list of our topics of discussion. What is HBOT? The science of HBOT, physiological changes that occur, benefits of HBOT, information, indications of use, contraindications, client info, and FAQs. So what is hyperbaric oxygen therapy, or HBOT? It is a well-established medical treatment involving breathing in pure oxygen at an increased pressure greater than normal atmospheric pressure. This causes a greater oxygen absorption in the body, and it hyperoxygenates the blood plasma, which enhances the body's ability to heal itself. As you know, every cell in your body uses oxygen, and sometimes your body needs a boost. Hyperbaric chamber greatly increases the amount of oxygen delivered to your tissues, streamlining healing by delivering oxygen-rich plasma to damaged or hypoxic tissues. Treatments with the HBOT will result in an increase in the rate of healing of injuries. It reduces the risk of infection. Treatments help to stimulate the growth of new tissue and blood vessels, reduces inflammation, and has many other benefits. Hyperbaric oxygen therapy enhances the healing process through many different mechanisms of action. Since oxygen makes up approximately 21% of the air you breathe every day, how much oxygen you actually breathe in depends on the atmospheric pressure where you are. So, for example, at sea level, atmospheric pressure is at 1 ATA. As you go higher in elevation, the pressure drops, making it harder for the body to bring in oxygen. The air in the HBOT is 100% oxygen, and the atmospheric pressure increases, and allowing more oxygen to be absorbed by the body in each breath, pushing oxygen into the hemoglobin of the blood as well as into the plasma. This is especially important to areas that need more energy or are in a hypoxic state, such as areas that are healing from wounds. There are several different HBOT chambers available on the market and are available in both hard and soft shells. The depth or dive range can be anywhere from 1.3 to 3.0 ATAs. Our chambers are hard shelled, and they provide a 1.5 ATA or 7.0 PSI, which is approximately the equivalent of going to a depth of a little less than 20 feet. Now, before we dive into understanding HBOT, let's remember that poor blood flow equals poor oxygenation, which equals tissue damage. So for us to truly understand why we see the benefits and results that we do with HBOT, you need to understand a little physics and a little physiology. In physics, there is a law called Henry's Law, which states that solubility of a mass is directly proportional to the partial pressure of gas about the liquid. So increasing the atmospheric pressure increases the amount of gas dissolved into a fluid. So when we increase the atmospheric pressure with oxygen, we will increase the amount of oxygen in the blood plasma. This will cause our bodies to be in a hyperoxygenated state, meaning that we have an increased amount of oxygen in our blood plasma, cerebral spinal fluid, and in our lymph fluid. So when we are at clinical atmospheric pressures, we are bypassing the body's normal system of transporting oxygen to the tissues, and we have 10 to 15 times the normal amount of oxygen available to our body. So the higher the pressure during an HBOT session, the more oxygen is pushed into the plasma, which is sufficient to meet our tissue's needs without contribution from oxygen bound to hemoglobin. This is the main reason why we see the beneficial effects of this therapy. So some of the physiological changes that occur in the body because of an HBOT treatment. It limits ischemia damage and cell death and inflammation. It helps to promote collagen synthesis, so fibroblast stimulation is increased. It decreases lactate production and tissue acidosis. It aids in oxygen-dependent killing of bacteria, limits leukocyte adhesion and degranulation, decreases tissue edema, stem cell mobilization, so it actually increases the amount of stem cells that are produced from our bone marrow and central nervous system. It helps to promote angiogenesis, and it is helping to increase new blood vessels. Oxygen is more than a metabolite. It actually initiates signaling transduction and action wound healing pathways in the body. So when you are speaking with clients in the spa, remember that HBOT helps to speed healing of wounds no matter where they are located. So think of recommending it to your clients when you want to have them reverse hypoxia, decrease inflammation, help fight infection, increase stem cell release, rejuvenate, and revitalize any tissue. So, as I said, it helps to promote healing, both internally and externally. So, a stroke or a heart attack would be still considered a wound, but it can think of it as an internal wound. What do we need for a recovery of injured non-necrotic tissue? There are 4 things. There's energy or oxygen. We need a trigger to stimulate the healing process, stem cells, and angiogenesis, all of which is provided in a treatment with the HBOT. So HBOT can enhance sports performance as well by speeding the healing of injuries, increased cognitive enhancements, improved cardiovascular fitness. It also helps to improve the endurance capabilities of the athlete and improve recovery. HBOT is the greatest synergies and you should think about it anytime there is inflammation, hypoxia, a wound, anaerobic infection, cancer, any immune dysfunction and or perfusion problems that arise. So when it comes to the HBOT treatments, there are a ton of benefits associated with regular use. Here is a short list of the most common benefits. Keep these in mind when you're having conversations with your clients, as treatments with the HBOT can help many of your clients reach their targeted outcomes. So it helps to improve oxygenation to tissue and organs, improved healing of wounds. You'll have faster recovery from tissue injuries and breakdowns, improved recovery from training, improved cognitive function, reduced inflammation, improved immune system function. You'll have an increase of ATP at a cellular level, which is increasing your energy at a cellular level. It increases the endurance and stamina of your client. It helps to reduce post-injury swelling. It will promote circulation, I can't speak. Increased stem cell growth and production, which also will help with the healing process. It supports the immune system. It will improve collagen production, and it improves mitochondrial function. In the medical system, as of July of 2021, the FDA has cleared hyperbaric chambers for the following disorders: air and gas bubbles in the blood vessels, anemia, severe anemia when blood transfusions cannot be used, burns, severe and large burns treated at a specialized burn center, carbon monoxide poisoning, a crush injury, decompression sickness, i.e. diving issue, gas gangrene, hearing loss, complete hearing loss that occurs suddenly without any known cause, an infection of the skin and bone in severe cases, radiation injury, skin graft flap at risk of tissue death, vision loss when it is sudden and painless in one eye due to blockage of blood flow, wounds, both non-healing and diabetic foot ulcers. There are still many conditions that receive benefits from the use of HBOT, but they have not received any FDA approval. Therefore, the HBOT in these conditions would be considered off-label use and is generally the area of treatment that we will be working on with many of our clients. There are studies that are being conducted in or on many of these different conditions, but are still not FDA approved yet. So that means that the clients cannot use their medical insurance to pay for the service. So reflex RSD, also known as complex regional pain syndrome, Lyme's disease, Alzheimer's, multiple sclerosis, macular degeneration, dementia, stroke, heart attack, asthma, autoimmune, brain trauma, concussion, COPD without pockets of air, carbon dioxide poisoning, anemia, inflammation after an injury, wound healing, PTSD, and there's so many more. This is a comprehensive list of contraindications. Decompensated CHF, severe upper respiratory infections, high fevers, emphysema with CO2 retention, history of thoracic surgery, malignant disease, highly vascular cancers, patients at risk for middle ear barotrauma, hypertension, low blood sugar, seizure disorders, COVID, although that is currently being studied right now for FDA approval, optic neuritis, aneurysm, full and partial collapsed lung, glaucoma, pregnancy, emphysema, ear infection or a blocked ear canal, severe lung or heart disease, and if you plan on flying within 24 hours. If you are currently taking any of the following medications, then hyperbaric oxygen therapy should be avoided. And you can see the list of those particular agents. One is chemotherapy, one is used for alcoholism, another one is a chemotherapy agent, and the other one is for prevention and treatment of bacterial or fungal infections. When discussing HBOT treatments with our clients, please remember the following information. Treatment length is somewhere between 60 and 90 minutes. There is a cumulative benefit when completing the treatments, and most individuals will need between 20 and 100 sessions for long-term changes to serious conditions, especially with neurological conditions. Treatments can be done 5 to 7 days a week. Because the chamber is an enclosed space, some people may feel some anxiety or claustrophobia at first. If you have difficulty in the past entering an airplane or an elevator, this might be an issue for you. Although it does have a nice window in it, the vast majority of people are able to get used to it after 1 or 2 sessions, and most are comfortable right away. As the chamber is pressurizing, the ears may pop, just as they would do when flying in an airplane or going up a tall building in an elevator. If anyone in the chamber has slightly blocked sinuses from allergies, it can cause temporary sinus pain as the chamber is inflating. This can feel like a stabbing pain behind the eyes or ears. If that occurs, it is necessary to gently depressurize the chamber a bit and then repressurize it more slowly. If the pain doesn't go away, then have the client come out of the HBOT. It is important for you to remember this information, as these are common questions that can arise. What should I do to prepare for a treatment? People go into the chamber fully clothed. It is recommended to wear loose, comfortable clothing. Shoes, jewelry, or any sharp objects should be removed before getting into the chamber. It is recommended that women not wear the stockings in the chamber because it may enhance the feelings of claustrophobia. The treatment, as I explained, length is between 1 to 2 hours per session, 5 to 7 times per week. Is hyperbaric good for the elderly? Most definitely. Hyperbaric is great for those in later years. It's very anti-aging. Hyperbaric provides an immeasurable boost which counteracts the signs of aging. In fact, new research indicates that hyperbaric oxygen slows apoptosis, which is the cell death, and can actually reverse aging on a cellular level. Is hyperbaric good for children? Yes, hyperbaric yields wonderful results with children. In fact, research with children suffering from brain injuries and genetic disorders shows positive results and great promise. We recommend that children under the age of 16 need to be accompanied by an adult inside the chamber. How will the H-Bot treatment feel? The chamber will be filled with compressed air. Once the chamber has expanded to its filled size, it will start to pressurize. When the chamber is pressurizing, your ears will feel the change in pressure inside the chamber. Otherwise, it should be unnoticeable. It will equalize the pressure and avoid the feelings of fullness in your ears. You will need to clear your ears by chewing gum or food or swallowing or yawning, sucking on a candy, etc. During the pressurization of the chamber, your mouth may become dry. Once the chamber is fully pressurized, your salivation will return to normal. Additionally, the chamber may become slightly warm while it is pressurizing. Once it is to full pressure, the relief valves will begin to pull the warmer air out of the chamber. Then you can sleep, meditate, read, watch a movie, listen to music, knock out work, etc. Are there any side effects to the treatment? The most common side effect is discomfort by the ears caused by the pressure changes. To minimize the risk, patients learn to promote the adequate clearing of your ears during the pressurization. Some patients may feel tired and dizzy after using hyperbaric chamber for the very first time, as the hyperbaric oxygen therapy does speed up the metabolism in our body. This can be an indication that detoxification is in fact occurring. If you have any questions, please by all means reach out to me. My name is Ryan Martin. I'm the Director of Modality Training and Education. My email address is on the screen right there, and my telephone number is 352-425-8431. My phone is usually on me at all times, so you can shoot me a text, and that is the best way to get a hold of me. Thank you again very much for taking the time to listen to the presentation today. If you have any questions after reviewing this video, please reach out to me. I look forward to answering your questions. Have a great day.